Call the honourable member for Durack.
Thank you, Deputy Speaker. I'm very pleased to speak on this matter of public importance and to help smash the myths perpetrated by those on the other side, because we on this side have got a lot to say, especially about healthcare in the bush. We on this side continue to be on the moral high ground when it comes to health, with the Turnbull Government increasing funding to WA hospitals by 27% in the next 4 years. Now, Deputy Speaker, this is an increase of $469 million, a mammoth increase by anyone's judgment. And in my patch, rural, regional and remote areas received about 1/3 of the total Medicare benefits scheme, known as MBS, benefits paid across all of Australia in 2014-15. So, Deputy Speaker, it is unfathomable why those sitting opposite try to attack this government on health. One would think they had nothing better to do with their time. In the 2015 budget, the government increased funding to a number of health initiatives and services. The government boosted funding to the Royal Flying Doctor Service to the tune of $20 million over the next 2 years. Now, Deputy Speaker, this brings funding across the forward estimates to over $137 million, which of course is a huge boost to my electorate of Durack and regional Australia. We announced the redesign of the General Practice Rural Incentives Program to better support delivery of medical services in rural and remote communities. We're also creating a new health workforce scholarship program, including rural return of service obligations to boost the rural workforce. We also announced new and amended MBS listings to assist rural and remote Australia. A couple of examples: a new MBS item for targeted interactive radiotherapy for early-stage breast cancer and remote monitoring of patients with implanted cardiac devices, which will eliminate travel for routine matters. Now, Deputy Speaker, these commitments build on the 2014 budget commitments, which include $40 billion over 4 years to create more inter-training opportunities in private hospitals and rural and regional areas, and over $52 million for infrastructure grants to support the teaching and supervision of the rural and regional medical workforce. Since being elected as the member of Durack just over 2 years ago, we've announced a number of health initiatives in my area alone, and two I'm particularly proud of is the new cancer centre, which will open in Geraldton in the near future, and we've also got a headspace which is also coming to Geraldton, and I'm currently now talking with key stakeholders in the Pilbara to get one in that region as well. So it's Labor's year of the big ideas, so this is the best they've got today. So one would say that's a bit of a joke. I'd say it's more of a year of negativity. And talking of Labor ideas, Deputy Speaker, I noticed with sheer horror, yes, horror, at the recent Labor announcement of the proposed $10 billion in infrastructure projects. What I did note, Deputy Speaker, that these were all in cities. All in cities, none in regional Australia. So Durack would miss out should we have those opposite holding on to the reins. So yet another example of those on the other side who don't know what the needs are of rural and regional Australia, and if they did, Deputy Speaker, they don't care about them, and they illustrated that with that announcement. So, Deputy Speaker, I note this latest Labor not-so-scary 15% GST campaign that they've been trying to execute unconvincingly. As our Prime Minister has said ad nauseum, any change to the tax system must be fair, and any increased burden will be borne by those best able to pay for it. The future prosperity of Australia is not just about reforming one type of tax or taxes full stop, but what we do require is a review of the whole range of taxes, including company tax, and also acknowledging and do something about bracket creep. These are the things we need to talk about. But we on this side, Deputy Speaker, we're up to the job. And you know what else we're up to? We're up to looking after the health sector because, Deputy Speaker, it is in very safe hands.